Welcome. My name is Peter Strong. I specialize in mindfulness therapy, which I teach online through Skype. One particular area that I work a great deal with is obsessive-compulsive disorder. So I offer online mindfulness therapy for OCD via Skype. So at the heart of OCD, of course, there are a selection of intrusive thoughts that have a very high emotional charge and that tend to compel you into unwanted, unnecessary, and sometimes disturbing behaviors. So the secret of overcoming OCD is to work with these intrusive thoughts and to neutralize them, to remove that emotional charge so that they no longer fuel the compulsive behaviors. So in mindfulness therapy, we do this by actually meditating on those thoughts. Now, this is quite different than the standard approach to working with intrusive OCD thoughts. Here, we deliberately bring them into consciousness so that we can change our relationship to those thoughts, so that we no longer become identified with them through the reactive process we call reactive identification. This is quite important because if you don't break that first step of reactive identification with intrusive thoughts, then there's nothing really to stop those intrusive thoughts from taking over and creating suffering. So we deliberately meditate on those thoughts, but we're doing it now on our terms. We're doing it consciously. It's our choice to do this. And that makes all the difference. So the way it works is you make a list of your intrusive thoughts, the ones that compel you to obsessive-compulsive behaviors, and then you train with each thought until you have broken that habit of reactive identification. Basically, you bring the thought into your mind and you train to sit with that thought without reacting or identifying with it. So you can hold the thought in the mind without becoming reactive and without falling into the reactive thinking that usually proliferates from that first reactive intrusive thought. You can train out of that habit of reactivity, and that's the first most important step. The second step in mindfulness therapy is neutralizing the emotional charge of that intrusive thought. And this is quite interesting because from my research over the years and practical experience, it's quite clear to me that the major factor that causes the emotional charge of an intrusive thought is its imagery. The way you see it in the mind is what actually gives it that emotional intensity. We look at that imagery. We look at its properties, the different qualities that make that imagery so intense. Typically, of course, the intrusive thought is going to be very large in size. So the size of that imagery is a major factor that determines its intensity. Also, its position. If it's in a very dominating position, we are likely to feel overwhelmed by the thought. And that's why it feels overwhelming, because we see it literally above us. We see it in a high position in our mental internal visual field. That position gives it power. So very typical ways of working with the emotional aspect of the intrusive thoughts would involve making them smaller and moving them to a lower level, putting them on the ground, for example. It's quite interesting how you can really change the intensity of a thought or a belief or a memory by changing its size and its position. So that's one way that we approach neutralizing the intrusive thoughts. There are many other aspects of the imagery we can work with, such as color, texture, and so on. The more that you see of its imagery, the more that you can change. And the more you change the imagery of the thought, the less power it has. So that's a very classic way that we use to work with intrusive thoughts, to neutralize their charge so that they no longer feel overwhelming and are no longer able to compel us into unwanted behaviors. So if you'd like to learn more about online mindfulness therapy for OCD using these and other techniques that I teach, then please reach out to me and send me an email. Tell me more about your particular circumstances and what you are struggling with, and let's schedule a trial therapy session. You will know very quickly if this is going to work for you. Most people see changes even within the first session. This is quite a different approach than conventional talking therapy or counseling. It's very focused on the process that creates OCD rather than just talking about feelings, which doesn't really change that process very much. It also doesn't use medications, so we don't recommend medications for OCD because, of course, those medications will do nothing to change the underlying psychological process that creates your OCD. So if you'd like to learn more about this very exciting and interesting way of working with intrusive thoughts, then do please contact me. Thank you.